A father regains the ability to urinate after the world's first bladder transplant. Could this shift the landscape of medicine?
Today is May 27th, 2025. Earlier this month, surgeons in Los Angeles performed the first successful human bladder transplant. Why is this so significant?
For years, if someone had severe bladder damage, the main option was to use a section of their own intestine as a substitute bladder. But that's far from ideal. Up to 80% of patients run into complications because the intestine just isn't meant to hold urine. That can end up harming the kidneys and even causing digestive issues.
And in this case, the patient, Oscar Lorenzar, had already lost both kidneys and most of his bladder to cancer and kidney disease. He'd spent 7 years on dialysis, and his bladder could only hold 30 milliliters. That's barely more than a shot glass.
Exactly. The surgical team at UCLA, led by Dr. Nima Nassiri and Dr. Inderbir Gill, prepared for 4 years. They refined surgical techniques, practiced on deceased donors, and worked out how to connect the tiny blood vessels deep in the pelvis. That's not easy. The bladder's blood supply is very intricate and hard to reach.
So in the operating room, what did they actually do?
They transplanted both a kidney and a bladder from the same donor. Before implanting them, the surgeons pre-connected certain veins and arteries to speed things up and lower the risk. Once the new kidney was in, it started making urine, which flowed right into the new bladder. For the first time in years, the patient could urinate normally.
That's a huge leap over current treatments. But what about risks, like organ rejection, or how well the bladder will work over time?
That's the big question now. The patient needs close monitoring for organ rejection and other complications. Doctors don't yet know how much immunosuppression he'll need or exactly how the bladder will perform long-term. But early results are encouraging. The kidney started working right away, and he's off dialysis.
Wait, how did they even get a donor bladder? That's not common at all.
Both the bladder and kidney came from a single donor. The team developed robotic retrieval methods and figured out how to preserve the bladder. That pre-connection of blood vessels made a big difference in streamlining the whole process.
Could this work for other patients? Or even for transplanting other organs?
Potentially, yes. Millions live with severe bladder conditions, whether from cancer, birth defects, or trauma. Instead of using intestinal tissue, a transplant could restore normal function. It also hints at the possibility of more complex organ transplants, but there are hurdles: surgical skill, finding enough donors, and getting regulatory approval.
And what about the ethics? Deciding who gets these organs, or how to train more surgeons for this?
Those are major concerns. Right now, this is just a first step, a proof of concept. Scaling it up to help more patients would mean tackling both logistical and ethical questions on a much bigger scale.
One last thing. Why does this matter globally?
Bladder disease is common worldwide, and until now, there hasn't been a good solution for severe cases. This transplant gives new hope to many and reminds us that medicine is still evolving, sometimes in ways we don't expect.
So, to sum up, after years of research, UCLA performed the first human bladder transplant, restoring normal urinary function for a patient who lost hope. Key innovations included robotic retrieval, pre-connected blood vessels, and a combined kidney-bladder transplant. There are still risks, but the implications are far-reaching.
Thank you for joining us. This episode was powered by mynews.studio. You can try it now for free.